I've dedicated my career to just educating and empowering women to be advocates for themselves.
Hey everybody, Dr. Axe here. Welcome to the show. This week I have a guest I'm really excited to talk to. It is Valerie Agyeman, and she is a women's health dietitian. She's the founder of Flourish Heights, and through her platform, she really helps empower women to take control of their health, and she has a lot of great stuff. I spent some time going through and looking for some of the best experts in the country when it comes to nutrition and diet, and came across Valerie and was just so impressed with what she's doing. Now, Valerie has written for many magazines, everything from Reader's Digest, Women's Health Magazine, Southern Living. She's been shown on local networks such as the ABC's Good Morning Show and others. And today we're going to talk a lot about nutrition, hormonal health for women, and so much more. I want to say, Valerie, hey, welcome to the show.
Thank you so much for having me. I'm excited to be here.
Awesome. Well, same here. Well, I know we've got a lot to cover today. And one of the things, again, I was so impressed about is looking at, what you teach your clients. The thing that I've also noticed is you sort of keep it simple. You talk about diet, you talk about things like nutrition, supplements, lifestyle, and also I've seen you talk about spiritual health, which I love. I think that's so important to our overall health. But I'd love to start off, what sort of brought you into the field of nutrition? And I know even before, we jumped on the line, we talked a little bit about sort of your family background, and I'm curious if, is that, you talked about being originally, or your parents from Ghana, how does some of this play into, or what led you into the health field?
Yeah. So, growing up, and like you said, I think there's just so much I've been through in my 27 years of living that have led to me to, pursuing nutrition, and has kept me on this path. From my unhealthy relationship with food and my body in my teenage years, to, understanding my family history of chronic illness. I mean, there's diabetes that runs in my family and heart disease. And so I wanted to, use nutrition to be a leader in my community. I learned about the power of nutrition and wellness at a young age for disease prevention and, management. I love what I'm doing right now within my community.
I love it. I think one of the things that I'd love to touch on just to start is you talked about some of the eating, some of the eating challenges you had when you're younger. Talk to us about that, and how did you what exactly was that you were struggling with, or as much as you want to share there, and then how did you overcome those challenges?
Yeah. And so I did mention briefly my unhealthy relationship with food and my body. I grew up in an environment where I was surrounded by, my peers who appeared to be super thin. I wasn't, a thin frame kind of girl. I was, I had hips and curves and, at a young age. And I remember when I was 8 years old, I went to the doctor's office and I stepped on the scale and told me I was obese. So growing up, I always thought there was something wrong with me and my body. It just, I was not healthy, or, whatever the case was, because that's what a doctor told me. I thought I was fine before that, I went to the doctor and they told me that. And so, growing up, I just had it in the back of my mind that, oh my goodness, something's wrong with me. I need to do something about it. And that's kind of what sparked this unhealthy relationship with food and my body. I was eating not as much as I should have been. I, kind of struggled with body image. I wanted to look like everyone else around me. And my peers were, thin and Caucasian girls in my community. I was usually like the odd one out, being the only Black girl. And so Black girl with big boobs, big butt, big curves, whatever. And then everybody else, looking just nice and thin. And I just wanted to fit in. And so, that's kind of what I thought I, knew at a young age. And, I think what helped me heal is just, learning more about nutrition. And there was somebody that came up to me one day, actually, and she kind of told me, you are beautiful. Like your curves are great. Like, own your curves. There'll be, women out here want to, look like this, be content with who you are. And I remember being in my teenage years and thinking, and, about what she had said to me. And it really just kind of was the start of this foundation to me learning more about, nutrition and wellness. I researched it, and then I got into, learning about how, diet and wellness, your lifestyle changes that you can make can impact your overall health. And even to the point of lowering your risk for many of these, chronic illnesses out there. And then when I looked at my family history and all of the, diet-related illnesses that, kind of run in my family, I don't want to be the one to continue on that path. I didn't want to let it become this sort of cycle. So I felt like, this was my calling. Like there was a lot of work that needed to be done. And, growing up and getting into high school, I would say around like the age of 16, going into college, I never knew a dietitian was even a thing. But I just was always drawn to nutrition and, wellness. I loved helping people, and I loved the science. And it's just funny how life works. You kind of end up doing what you were called to do. And that's typically what I do now, just educating and empowering women in their health and in their wellness to prioritize that.
I love it. It's great. Again, one of the things I was so impressed with as I was reading all the things that you've done and accomplished in really such a short time. Obviously, you're, could be seen as fairly young. I remember when I first opened my functional medicine clinic many years ago when I was practicing and being, 27 years old. And, but at the same time, being in the field of nutrition for much longer than that, I started studying nutrition 10 years prior about when I was 18 and studied it for almost 10 years. And so, one of the things I'm curious about is, I was reading online about some of your protocols and what you do with clients today. And one of these, and we're going to jump more into, and I'm excited to talk about more of your dietary and nutrition recommendations. But I had read you had this thing down, and it was called 5 Ways to Persevere When Faced with Health Challenges. Can you go through 5 of those steps or some of them and how people that are facing health challenges can overcome those? Because I think sometimes it's more than just eat this food or don't eat this. Sometimes there's more of a mental aspect. So can you talk about what you recommend for your clients there?
Absolutely. And, it is tough, especially, and you as a doctor, I mean, you see this all the time, right? When somebody's diagnosed with some kind of health challenge and, you kind of see what they go through. It's hard. It's difficult. You're living your life you're living your best life. Let me add that. And then all of a sudden, like in just a day or whatever the case is, you get hit with this and it's like, what do I do now? Right. And so dealing, with the emotions, it's not easy at first. When you're diagnosed with something like, because I'm a women's health dietitian, I focus on reproductive health issues, from fibroids to PCOS and endometriosis. When you're diagnosed with those kinds of things, it can be difficult to kind of identify and like honor those feelings, and, most women feel so overwhelmed because this is a time where, maybe there's some drastic changes that you need to make in both your diet and your lifestyle as a whole. And, it can lead you to even feeling more stressed. A combination of, these emotions can even lead you to, battling emotional eating, which can lead to weight gain, weight loss of appetite, and the list goes on, even disordered eating, and that's a really big one that a lot of women face. And sometimes, it's pretty silent. So I think that, going through these motions are very common, and it's super normal because we're human beings, right? And so, but I just want to empower somebody today and our listeners that, be kind to yourself, tune into your body, pay attention to what you're feeling, spend time with the people who are, positive and uplifting. And also, I think that can help with just your confidence, around the time that, you're going through these sort of emotions. And I have a few tips, and if you wanted to go into those.
Yeah, let's do it.
Yeah. So when it comes to kind of, what to do after you're diagnosed with, something like a reproductive health issue or whatever health challenge that you're currently facing, I believe the first thing that you need to do is kind of like release, right? Whatever it is that you're feeling, and then accept. And so during this time, recentering is super important. Like, what is on your mind? How do you feel? It is okay to go through the motions, and that's what I want people to know. But I think it's finding out, how can you release? A wellness tip, and I absolutely love doing this just, on my own, is journaling. I love journaling. And, as a believer, I think another thing is, praying to God. I think, whatever your spiritual kind of, faith is or practices are, taking time to get in tune with your spirituality, venting to a loved one, crying, whatever it is, release those emotions, especially after being faced with a health challenge. And I think acceptance really is, the beginning of persevering on your health and wellness journey. And I would love to just quote this verse because it's really helped me so much in just, other challenges that I face in my life. Philippians 4:6-7, do not be anxious about anything, but in everything by prayer and supplication with thanksgiving, let your requests be known to God. And I think it's just finding out what kind of puts you at ease and kind of helps you to, calm and work your way towards acceptance.
I love it. So step number one, we have to, again, being in denial. And again, I know that obviously there's some things that are really hard. Like I know when my mom was diagnosed with cancer, at first there was this sort of like, you go through this short period of time where or for some people it can be longer, but it's like, there's this denial that you have it. But the first thing, it's so good you're saying this, it's accepting and saying, okay, this is reality. But then releasing it, and I think not allowing that to become your identity, which I think is so good in what you're saying. And so after that, once somebody says, okay, I realize I have this diagnosis, I'm not going to let it define me. What do we do after that?
It's going to vary for everybody, right? And I just want to point that out there. It's going to vary for everyone. But I think another way to kind of move past that or move, towards healing or whatever that looks like to you is to gain and maintain optimism. So not to gain the optimism, but to find practical ways that are going to work for you on how you can maintain. So speaking positivity over your life. And, we can talk about ways to be positive. It's going to be different for everyone. But I think it's so important to have a support group. And whether it's your family or a friend, someone that can speak positivity in your life. And you want to avoid being around negative Nancy's, okay? Because they're going to bring you down. And, what help or what good would that do? If you're trying to just have this mind that's just clear and it's just positive, practicing gratitude. I think in the midst of the storm, right, there's always good things to look at. Talk about the things that you're grateful for. Write it down. Talk about it with your friends and your family, your loved ones, just to capture the thankfulness that you feel on a daily basis. This is an everyday thing. Like I said, maintaining optimism, not just identifying it, but what are you going to do every single day to make sure it's continuous? And sort of to train your mind, there's negative thoughts that we all go through. Let's be real, right? And so if you can find a way to just replace it with a positive one, I think that, over time, it's like your brain just automatically turns every negative thing to a positive thing. And it's, easier said than done. But I do believe that when you speak positivity over your life, it really makes all the difference. So I would say that's the second thing.
I love it. It's so good. It reminds me of this, Valerie, when I ran my clinic, and even still today, if I am having a conversation with somebody about their health and giving some advice, I can almost tell immediately if they're going to get well or not. Now, I'm not saying it's every time, but I'm saying, because here's what happens. It so much has to do with exactly what you're saying and the advice you're giving. It's this mindset. When I had patients come in and I'll give you an example. I would say, hey, let's change your breakfast. You're eating the cereal or the bagel and cream cheese or whatever for breakfast. I want you to start doing this superfood smoothie with some coconut milk, some berries, some collagen. I got one of two responses. One was, Dr. Axe, that sounds fantastic. Hey, this smoothie, man, this tastes like a strawberry milkshake. This is great. Like, I'm excited to do this. And even telling them, hey, you're going to get well, they would believe it and say, I am going to beat my diabetes. I am going to get well. And then there was another group of people that would say, oh, like, I can't have my, my conventional milk and my, GMO corn and what and like literally obsessing about all the things they couldn't have, focusing on the negative. Those people had a very hard time getting well. So anyways, I just wanted to speak to that. It's such a good point because I mean, that mindset is maybe the biggest, it's one of the biggest things in people healing. So anyways, I love your point there.
So important. It's so important to reframe your thinking. And it really does make all the difference. So the third thing I would say is, set realistic health goals and not only set it, but intend to achieve them, right? And to be consistent. So, if you need to see a therapist, that's like a, huge thing, and to kind of attend to your emotional and mental health and mental wellness. Whether it's seeing a dietitian to help you with your eating planner, to guide you and help you to reach your goals. What steps are you going to take to achieve these goals that you have? And it's already hard enough to have to deal with a diagnosis. And now, sometimes it's these huge drastic lifestyle changes that need to happen. But, don't try not to be too overwhelmed. Like, make small, realistic goals. Don't compare yourself to others. Don't be so quick to jump on the next diet you see just because, everyone else is out there. Keep up with your doctor checkup. So whatever it is that you need to do to kind of, pick yourself back up and say, okay, like I've, went through this. I've accepted this. I'm ready to work on these goals, these realistic goals. I think, now it's the time to do that because you have to be ready, right? If you're not ready and you're still dealing with emotions and all that, I mean, it's going to be so frustrating. It's going to be so overwhelming. So I think take a step back, take a couple steps back because, wellness is a journey. It's not a quick fix. So, you can definitely take a pause, right? And then find out where you're going next. And if you need guidance, seek some help.
I think it's great advice. Again, have goals and then have whether it's a doctor or a dietitian or someone who's knowledgeable, helping you along the way. I think that's so important. You've mentioned community so many times too, and I agree with you. Having the right people around you, like my biggest life lesson, if someone were to ask me, is you become who you surround yourself with. So I agree. Like if you have people in your life that are not encouraging, get around those encouraging, life-giving people is a big deal too. But I love that setting healthy, realistic goals and resetting those goals along the way. So what's tip number 4 that you have for us?
Yeah, tip number 4 is really just, this is where the whole like holistic wellness part comes in. It's like caring for your mind, your body, your emotions, whatever it is, being still and taking it easy, tuning into your body. I know we hear that all the time, listen to your body, tuning into your body. What does that really mean? It's, for example, doing a body scan, getting familiar with your body, something feeling abnormal. Are you in pain? How are you feeling? Are you thirsty? Are you hungry? Those are some of the things that you can do to, questions that you can ask yourself. And it's an everyday effort. Like I said earlier, your wellness is a journey. It's your unique journey, and there's certainly not a race. So it's super important to be intentional and to find out ways you can, prioritize it by checking in with yourself, having a self-care routine because you matter, and whatever that looks like to you. So, taking it from a holistic standpoint and now trying to put the pieces to the puzzle, because we can talk about nutrition, that's fine, but your mental wellness is connected to your nutrition. Your emotional wellness is connected to your nutrition. I mean, your financial wellness is also connected. So, we need everything all at once. So, really try to, tune into your body and find out how you can contribute towards your overall wellness.
I love it. So again, here it's listen to your body is step number 1, and then create a really good self-care routine along with that. That's fantastic. Those healthy habits. What's number 5 thing that people should really be thinking about when it comes to how to overcome health challenges?
Acknowledge your accomplishments, big or small. even the smallest ones are amazing, whatever that looks like to you. It's so important because you have to celebrate your wins. I mean, you are going through so much. You are doing a great job. It's not easy, but just waking up and, taking on the day is, it's amazing. Like you did that. And so take time to acknowledge your successes. For example, whether your labs came back in a normal range, you are working on your iron levels, whatever, through your diet or whatever the case was, and now it's back in the normal range. Hey, like it's like that's a party.
Yeah.
And or your blood sugars, maybe your A1C was really high, and you wanted to work towards lowering it. That's amazing, because that's really hard to do sometimes. And, or, you found a way to manage your stress levels. I mean, I can definitely work on that right now. Or getting more hours of sleep. Like, shout out to the moms out there and the dads.
Oh, man.
To get their sleep in, as difficult as it is. Or, even when it comes to body image, postpartum bodies. Sometimes it's like whether you tried a new strategy to find out ways you can accept and love your new self after your baby, reframing your thinking and looking at how you were able to grow this baby, in your womb for however many months, and you through life. It's beautiful. So my point is, really take time to celebrate whatever it is that you, succeeded at, and keep going. It never stops. I think it's great because it also motivates you to keep going. And that's what we want to do. We want to keep going. We don't want to just stop where we are.
I love it. So good. This mindset of growth and continuing. And that's what, I love too about your brand is this Flourish Heights. By the way, if anybody wants to check out, I encourage everybody, run out and check out Valerie's website. It is flourishheights.com, FLOURISH Heights, HEIGHGHTS, flourish, like flourishing plants, and heights as in height. So flourishheights.com. You can also check her out on Instagram. These are some great tips. I had a few more questions for you. One of the things I wanted to ask you about, I know we were talking about earlier about your ethnicity and some of your relatives and family coming from Ghana. And I know you're a brilliant, as I'm learning, African-American woman. The Black population, especially women, as we're discussing, suffers more from certain health conditions compared to other women. What advice do you have also specifically for African-American women? Because I know the rates, especially of diabetes and heart disease, are absolutely higher. Are there any specific tips you have for women, for Black women, in terms of how they need to take care of their health?
Yes. And, before I get into that, there really is a story of why I even wanted to focus a lot of my wellness and, my education to women, but particularly women of color. I've been in this field for about 8 years, and I've been a dietitian for about 4. And every single day, I just become more and more passionate with helping women and women of color take charge of their health, because it's so needed. And when you look at the internet, as there's so much misinformation when it comes to nutrition. And at times I feel as though mainstream media wellness is just not as diverse or even inclusive of other complexions, hair textures, and even body sizes. And so this is what pushed me and motivated me to create this space, this women's health platform, Flourish Heights, because women of color, we just aren't well represented. And, it's just so important to just have this safe space to, for women of color to feel like they can flourish in their wellness, even when health challenges comes their way, right? Like what we just talked about. And so I've dedicated my career to just educating and empowering women to be advocates for themselves. And so, like you had mentioned, a lot of, Black women are more likely to suffer from reproductive health challenges like infertility, fibroids. I mean, it's huge, right now in the limelight, heart disease and many more. Like you had also mentioned, the heart disease and the diabetes. And, there's so many factors as to why this is the case. And some of it, honestly, it's just, racism in the healthcare system, things like that. social determinants of health, when it comes to access to safe and affordable housing, healthcare, access to affordable, nutritious food, the list goes on. But I think it's just so important for women of color, Black women, to be their own advocates. And I talk a lot about that, in my platform. We host women's health conferences and workshops, and we collaborate with other health professionals that focus on various areas. Like back in March, we hosted our 3rd annual Bloom, where it was kind of like our launch to, focusing more on reproductive health issues, because I saw that there was a gap from, just being more educated about these kinds of things. It's so important for Black women to know, so we can know how we can navigate through the healthcare system. We can know, what to do to, maybe prevent some of these things. How do we get from, where we are right now to where we need to be? And there's just a lot of miseducation out there. And I just want to just empower women, inspire them to, get up and do the research that they need to do. Seek help and also, continue to stay educated and advocate for yourself, because your wellness really, really matters. And so through the constant education that we do, and like I said, collaborating with other health professionals of color, we really are just inspiring a healthier community.
I love it, Valerie. It's great advice. And I think just on a few things you mentioned, I think of when I started studying this and looking at what's the relationship between a lot of these conditions. One of the big things, as you know, is it's this insulin issue. It's insulin balance. If you look at fibroids, PCOS, diabetes, of course, and heart disease, there's an issue with blood sugar, right? Blood sugar is such a big deal. And I think that's one of the things that as we're talking about this, is that I think that a lot of times that there hasn't been the right access, as you're saying, to the education. And that's one of the things I respect about you so much, is like you're going out there to an area and a group of people that haven't had the access as other people have. And I don't think that's been fair. And so anyways, I just want to say, I think that access is so important that you're able to get out there and do. And so I love that. And the other thing is, again, it's this issue with blood sugar, which is a really big deal. And I can tell you from now, I practice in the South, and this is just worse in the South in general, but there's a lot of sugar and carbohydrates, that are being consumed. And I think that's something as well that creates a problem. Let me ask you this: as you've worked with people, would you, and you don't have to agree with it, but would you say that you kind of see that also as being a big problem, this overconsumption of sugar and carbohydrates being a big thing that's also, from an actual dietary standpoint, contributing to a lot of these conditions?
I do feel as though, your modern Western diet is very packed with your, refined carbs and all those sorts of things. And, sometimes it's maybe more consumed compared to, other healthier options. But, I do feel like there's just so many variables.
Sure.
There's so many variables, so many factors. And, research now is looking a lot at, if we want to, be more specific and focus on a specific area of, for example, like maternal mortality. Racism is one that is showing up in these research studies.
Sure.
At times, cultural competence, is not really as a lot of health practitioners aren't really trained in it. And that's affecting health outcomes. I think there's just so many ways so many angles we can go. It's just a very broad kind of thing, and I feel like there's a lot of work that can be done in each of those variables. And I do believe that educating, advocating, and continuing to provide these sort of safe spaces are important to sort of see change with health and lifestyle and diet and, everything else that's related to that.
100%. Yeah. I agree with all of those points. Absolutely. So let's dive a little bit into diet here. I know you being trained as a dietitian. So let's talk about that a little bit. When you have clients come in, what are some of the biggest things you do diet-wise? What are some of the biggest things that you say, we've got to cut these out of your diet and we should add these foods back in, generally speaking?
Yeah. And so I'm really excited because in the fall, I will be opening my virtual online counseling where I'll be, working with women with fibroids and PCOS, endometriosis, body image, those kinds of topics. But, in my previous role, I was, kind of coaching women, and a lot of the times, nutrition really is a super complex kind of thing. And, my approach really is, it's not a one size fits all. It looks different on everybody.
Sure.
But I say that sort of like the same messaging that does come up is just, eating more, plant-based foods, whole grains, fruits and vegetables, nuts, seeds, legumes, beans, whatever, those kinds of foods, because they're just so nutritious and so much, so many research studies are looking at, the power of the nutrients that are in these kinds of foods, how it can ward off some of these health conditions and, lower your risk for things like certain cancers. And, you eat colorful, it's filled with antioxidants, and those antioxidants are going to help eliminate those free radicals from your body. And if we're talking about reproductive health issues, sometimes we're recommending, these specific foods because it's going to help eliminate excess estrogen out of your body, or it's going to help you to, balance your hormones more. And so the list really goes on, but I think some of the common sort of things, it's, eating more plant-based, it's, and doing what works for you, eating more plant-based, eating more fish. I also do work for a nonprofit organization helping Americans to eat more seafood as a part of a healthy diet. And so, Americans just aren't eating enough, per the dietary guidelines for Americans. And so, incorporating more fish into your diet. I mean, it's super nutritious, as well as lean protein.
Yeah.
I think the issue there too is people just don't know how to, cook with it, or they don't know how to select it, prepare it. And so it's really just, talking about simple things that people can do to kind of lead a healthier lifestyle and as it relates to diet. And I think, we overcomplicate it when it really is to be, super simplified. And that's what I love doing as a dietitian too, because I get to use my platform and my voice to just show people that, healthy living and healthy eating is doable with what you're already doing. It's like, keep doing what you're doing, right? But, make small changes here and there in your diet and then work from there. It's not, you don't have to do this drastic, super big change. It's just like, take it pretty small and you'll get there.
I love it. It's great advice. And one of the things that I remember when I first started changing my diet, I just changed breakfast, and I could already tell just by changing one meal a day. I mean, I got so much healthier, and I've recommended people do the same. So it's great. And by the way, I think, it's great advice is like this. We need more plants, especially as we're talking about the vegetables you mentioned, the fruits you mentioned, and things like wild caught fish with those omega-3s. So anyways, I love that.
I love omega-3s.
It's great advice. All right. Well, hey, I want to encourage everybody, again, check out Valerie's website. It's flourishheights.com. And also her Instagram. You can just look up Flourish Heights there on Instagram as well. And I want to say, Valerie, thanks so much for coming on and sharing your wisdom today. By the way, I loved your 5 steps to overcome health challenges, because we know that, overcoming health challenges, it's part of it is changing your diet, but it really starts with this whole mindset. And I loved, you quoting the scripture there as well. I think it was Philippians 4:6-7, which anyways is one of my favorite verses as well. And I also appreciate you just being out there again, just being a positive light in the world. So I want to say, hey, thanks so much for coming on the show today.
Yeah, thank you so much for having me. I do appreciate it. This was awesome. I love all the work that you're doing. So I'm excited to continue to follow.
Awesome. Sounds great. Well, thanks so much, Valerie, for coming on today. And hey, thanks everybody for listening. I'll be back next week with another podcast. We'll be back here again very soon. Thank you.
This podcast is for information purposes only. Statements and views expressed in this podcast are not medical advice and have not been evaluated by the Food and Drug Administration. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. In some cases, individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.